Good afternoon, everyone. Good morning, good evening. I'm delighted to welcome you to today's webinar on strengthening gender responsive and inclusive social protection through technical assistance. Today we're going to be discussing some of the lessons learned through the STAR facility and the implications for future practice. For those of you who don't know the STAR facility, the acronym stands for the Social Protection, Technical Assistance, Advice and Resource Facility. It's funded by the UK's FCGO and has been delivering support on gender responsive and inclusive social protection and social assistance in crises. This webinar is the first of STAR's three-part webinar series. Just to give you a quick overview of STAR, so it started in 2022 and is coming to a close in December this year. It's a demand-driven and flexible service. Under the gender and social protection window specifically, we've delivered over 60 assignments, ranging from long-term advisors embedded in institutions, for example, UN Women. We've done discrete pieces of research, for example, on gender in crises, on women's economic empowerment and LGBTQ. We've also delivered capacity building and supported policy advice, for example, on the care economy and child marriage. We've been delivering this work to governments and development partners working in over 50 countries. And we work with national organisations, research institutions and consultants to deliver the technical assistance. And we're very pleased today to have the participation of some of our esteemed partners and consultants. So my name is Rebecca Holmes, and I will be your moderator for today. I've been leading the portfolio of work on gender responsive and inclusive social protection under STAR. And the aim of today's webinar is not only to highlight some of the progress and the successes in terms of what works and how technical assistance can accelerate progress on strengthening gender responsive and inclusive social protection through its systems, through its policies, and through programming, but also to highlight and discuss some of the challenges and how they can be overcome, for example, in navigating politically challenging contexts. So before I introduce the agenda and our speakers in a bit more detail today, I'll just briefly go through some housekeeping rules. So this session will be recorded and will be available online afterwards. Please do use the chat box to introduce yourselves and to kickstart discussions, share relevant links and experiences as we go through the webinar today. We also have the help of AI in generating closed captions, and there's a closed captions button at the bottom of your screen. Please also interact with us and use the Q&A box to post any questions that you have for the speakers today. And please remember to contextualize your questions and name who you might be asking the particular questions to, so that we can collate these and then we'll have an opportunity to discuss them in the latter part of the webinar. So in terms of the agenda, as you can see, we will start with a discussion from colleagues in Cambodia, followed by 3 short presentations before opening up for Q&A and closing. And in terms of our participants and our speakers, we're very pleased to have a fantastic group here today. We have Sovannary C, a social protection senior analyst of the General Secretariat for the National Social Protection Council, or the GS-NSPC for short. They received technical assistance from STAR, and Bopha Poch, the gender equality and social inclusion consultant in Cambodia, was part of the team delivering this assignment. We will then have presentations from Sam Coope, who is a social development consultant and delivered an assignment in Eswatini, Muriel Ametoglo, regional feminist economist and gender and economic policy specialist in UN Women, and also Aline Coudouel, the manager of the Sahel Adaptive Social Protection Programme in the Social Protection and Labour Unit for Western Central Africa region, the World Bank. Then we will also have Heather Kindness, the Social Protection Team Leader from FCDO, giving us closing remarks. So thank you to all the speakers for being here today. So let us start with a discussion focusing on Cambodia and the work that was going on in Cambodia over the last year or two. So Sovannary, let me ask you a question first. You're the gender focal point and lead the GS-NSPC work on integrating gender in social protection in Cambodia. Could you tell us a bit about Cambodia's social protection system and what type of social assistance you received?
Thank you, Rebecca. It's a pleasure to be here talking about the social protection in Cambodia. So the Cambodia social protection system has made a significant strides, especially over the last decade. It's a key part of the government strategy for poverty reductions and human capital development. And the system consists of two main systems, which is the social security, the contribution base, and the social assistance that are the non-contributory tax-funded program that provide direct support to the poor and vulnerable household. And the social protection system in Cambodia is mainly driven by the National Social Protection Policy Framework, which has recently been updated to the new phase starting from 2024 to 2035 to adapt to the current socio-economic situations. And the framework is a key document that outlines the government vision for a comprehensive, sustainable, and inclusive social protection system for all citizens. It aims to move beyond simply providing a safety net to actively helping people escape from poverty and be resilient against future shock as well. And this system is a fundamental part of our government's commitment in developing the social protection in Cambodia, and it includes an emphasis on gender responsiveness as one of the core principles. Although we have already been integrating gender aspect in the existing social protection system, but the picture was not clear, and we didn't know what could have done better to improve the gender responsiveness in the system itself. It's actually a complex process that requires deep analysis to identify and address gender gaps. And this is precisely why we sought out technical assistance, and yes, the facility program has been instrumental in this effort. And the assistance serve as the backstop for our team, especially in the GS-NSPC, providing the technical inputs on the report from the gender assessment work stream that GS-NSPC is currently working on, and also advising us on how to be more effective and efficient in the gender responsive part. And it is also timely when the team were in the process of designing the current National Social Protection Policy Framework as well. And this is where Mrs. Bopha and the team came in. I know there were significant challenges, and I'm keen to hear about that from your side as well.
Thank you very much, Sovannary. And so, Bopha, you were part of the team implementing the assignment through STAR. Did you face any difficulties in terms of responding to the government's requests? And if so, how did you overcome those?
Yes, thank you so much, Rebecca, and I'm very pleased to be here. And good evening, everyone from Cambodia. I'm Bopha, Gender and Social Inclusion Consultants, and my background is gender and development. And I have experience working on gender-related sector for more than 15 years in Cambodia. And lately, I have worked for Oxford Policy Management with Team Conways, an international consultant, to provide technical assistance on gender responsive social protection for the General Secretariat for the National Social Protection Council under support from STAR from June 2024 and March 20 to March 2025, as Sovannary mentioned. And the technical assistant, we focus on 3 main areas. First, to reviewing and providing technical inputs on the process and report on gender assessment and social protection, which supported by GIZ. And analysis and development on the management response plan was conducted based on the finding from the gender and social protection assessment. And second, we providing the capacity strengthening to GS-NSPC team on gender responsive social protection by conducting 2 series of trainings related to the gender responsive social protection. And lastly, we providing on-demand technical assistance, as Nari mentioned, including the Friday session, building on gender-related knowledge aside from gender-responsive social protection to accelerate gender-responsive social protection implementation. For instance, we have covered the gender-responsive budgeting, gender mainstreaming in institutions, and investing in care economic and its linkage to the social protection. Of course, that there are some challenges as well. So I would like to raise only one main challenge related to the delay of completion of the gender responsive, the delay completion of the gender assessment and the social protection study, which supported by GIZ. And this leads to setback the STAR technical review and also knock on the effect on the implementation of other assignment as well. And the solution, we have a consensus between the GS, the consultant team, and also the facility DAI to shift the order of the assignment, the order of the task, in order to maintain the timeline and also the effectiveness of work. For instance, the capacity development supposed to conduct after the finalizing of the gender assessment, but because the gender assessment was delayed, so we have moved the capacity development to conduct earlier. So it is the flexibilities that lead us to success on our assignment, and of course that it is quite challenges with these for our team as well. Yeah.
Thank you, Bopha. Yeah, timing and sequencing is often a challenge, I think.
Yeah.
But good to just hear how that played out in Cambodia. And so, Sovannary, from your perspective, what would you say have been some of the key successes of the technical assistance that was provided? And in what way have you been able to achieve something that you wouldn't have otherwise been able to achieve or progress or move towards had you not had that technical assistance support?
Thank you, Rebecca. Like Mrs. Bopha has mentioned earlier, actually the tangible successes we've seen are actually the direct result of the technical assistance itself. The technical review of the gender assessment report, for example, was very useful, even given its delay, but it's still making a significant idea to what we are doing in the report. And it's gave us a strong foundation to draft our the so-called the management response plan, which was a crucial step in formalizing our plan in formalizing the gender responsive in social protection. But what really stands out is the capacity building component, which was brought forward and expanded at our request, at the GS-NSPC request. The training actually provided in 2 concentrated blocks was highly effective. And the first block focused on core concept of the gender and how it links to the poverty and vulnerability, while the second block touches how to make our social protection policy and program more gender responsive, which gave us more idea how we are going to make the policy in the new social protection policy framework more gender responsive. And yeah, the feedback from our team was very positive as well. Thank you.
Great, thank you. That's really good to hear. You know, great that that capacity building and support was so well received within the government as well. And Bopha, from your side, from your perspective, what do you think are some of the key factors that contributed to, you know, being able to deliver that TA in a way that was tailored, that was sort of specific to the needs of the government? You're on mute, Bopha.
Very sorry. Well, several factors have contributed to making technical assistance work effectively. First, the commitment from the government, GS-NSPC, is the key factor that make this technical assistance go smoothly and effectively. As a result, as Nari mentioned, that the new social protection framework included gender responsive as one of the core principles. In this social protection framework, meaning that all the policies, program, design, delivery, communication, M&E framework would consider gender as a key aspect. And the second, the common understanding of the expectation on the technical assistant and the flexibility of the GS-NSPC team, the consultant team, even the delay of the assessment, and also the facility agency DAI. We agree to shift the order of the task and given the practical situation. And also another factor is linked to the technical assistance provided at the right time, as I mentioned earlier, when the General Secretariat was developing the second social protection frameworks, 2024 and 2035, leading the design new social protection framework was took gender into accounts. Yeah. And also the transgender assessment social protection report inform even the draft of the gender or the finalizing of the gender assessment delay, but the data and the information from this study have informed well the design of the training curriculums and training material. And so with those information, identify the gender gap and how those gaps should be addressed in the design and delivery of the social protection program in Cambodia. So the training not only focus only on the theoretical, but also from the practical experience of the other country, and also the real experience or the gap that exists in social protection, the gender gap that exists in the social protection system in Cambodia. And importantly, the network and the coordination while staff provided technical assistance to GS-NSPC, Oxfam, in Cambodia also provided technical assistance on gender responsive social protection to Ministry of Women Affairs. It is the missionary to promote gender equality and empower women in Cambodia. So, and in addition, MOWA is a key member of the Social Protection Council and also a key member of the Executive Committee of the Social Protection in Cambodia. So both technical support from STAR to GS and from Oxfam to Ministry of Women Affairs make a life of knowledge on gender responsive social protection in Cambodia, which is the new experience in Cambodia. For the Ministry of Women Affairs themselves, social protection is also new, and while the GS gender responsive in the social protection is also new for them. So both technical support, it's building the insightful knowledge of both entities to build up the gender responsive social protection system in Cambodia. Yeah, and they can work closely together and support to each other.
Thank you, Bopha. I think it's really interesting to see also how STAR sort of is contributing and fitting into this wider process and wider contributions of what is going on, but the importance of that network and sort of support and contributing to a process. Sovannary, one last question to you in terms of what do you feel are sort of the key takeaways from receiving the technical assistance from the government's perspective? And do you have any advice for other governments in terms of how technical assistance might be able to be used to support and strengthen more gender responsive and inclusive social protection?
Thank you, Rebecca, again. My personal key takeaway is that the effective technical assistance is actually the flexible partnership, like Mrs. Bopha has mentioned a lot about the sequencings of the work plan and others. And the flexibles, it's not a rigid and predefined plan. We saw this firsthand with the change in the project timelines, which require change in our approach as well. And the OPM team, including Mrs. Bopha and Mr. Tim Conway, was able to adapt and even increase the importance of the training component to address based on our needs. So actually there were the assessment, the pre-assessment that to identify the knowledge, gender responsive knowledge within the GS team, and the feedback was very positive back then. And yes, their flexibility made a very good result in this. And my another key takeaway for the other governments would be for you to be clear what you want in developing the gender aspect or gender responsive or gender transformative. What you want, please be clear and try to find partner who are willing to be flexible with you as well, because as a government we can be fixed. It really depends on what is going in that situations. And yep, that for now. I have my two key takeaway here. Thank you.
Thank you so much. Yeah, I think the realism is really important in terms of how governments work and that importance of timing and sequencing and flexibility. Bopha and Sovannary, thank you so much for your discussion and for your contributions. I'm now going to hand over to Sam, who is going to talk a bit about the work that she'd been doing in Eswatini.
Thank you so much. And good afternoon from Zimbabwe, everybody. I'm an independent consultant in gender inclusion and social protection, formerly of FCDO, and now beaming in from Zimbabwe on a project that I undertook with STAR and some research colleagues, Lungile Mabunza and Ndumiso Sibuganli from Eswatini. And yeah, this presentation is called Social Protection TA in Practice, Reflections from Eswatini. It really should be called What I Learned About Context Sensitive and Politically Smart Technical Assistance from Eswatini. It's a subject that I thought I knew a lot about when I started this exercise, but actually it was really quite a humbling experience in discovering how much there was still to learn from working in different contexts, even when they are your next door neighbour in Africa. So I'm going to start off the presentation, if we can flip to the next slide, with a context sensitive approach in mind. I'll just start off with a few words on the more kind of, I guess, unusual or defining characteristics of Eswatini itself, in that it's an extremely small country, one of Africa's smallest countries. It's a lower middle income country, but most people are actually in extreme poverty because the wealth of the country is very firmly focused in the hands of the elites. There's a mixed picture on gender equality. On the surface, a lot of the traditional gender indicators look absolutely fine and nearing parity, if not achieving parity. But that kind of masks a lot of inequalities that lie beneath, that are very much entrenched in traditional and customary structures. As a country that frequently has the world's highest rate of adult HIV prevalence, there's a particularly heavy burden on women as carers and as people who are more likely to have HIV themselves. And a real defining feature of the country is that it is an absolute monarchy. While there is a parliament and what looks like a normal functioning government, the king does have ultimate executive authority, and that modern state framework runs alongside a very strong parallel traditional system. So more on that later. Next slide, please. Next slide, please. Thanks. And the project goal itself was to was a technical assistance exercise. It was to strengthen gender responsive and age sensitive social assistance in Eswatini, working with UNICEF Eswatini as the client to support the government and partners in firstly in reviewing the system and the programs themselves, setting those against international best practice, and then drawing out some key lessons for reform, for adaptation, for new programs or interventions within Eswatini's system, and finally to deliver training to key stakeholders on gender responsive social assistance, and to formulate a policy brief and roadmap, with the roadmap really focusing on the most promising entry points for reform, for change, for adaptation over the next 1 to 5 years. Next slide, please. I'll not focus on the actual findings really of the exercise itself so much as reflecting on the process and how that went in practice. In terms of the strengths of the process, there were a lot. It was a really strong group of people. There was some really great learning and some really great collaboration with a very effective core group from UNICEF, from government, and of course from STAR, and so really engaged civil society and partners, particularly important in this kind of context. We found to get the international perspectives as well as the local, and I'll go on to that in a minute. The participatory workshops that we undertook, as well as the primary and secondary research, were the real linchpin of the exercise. Not just because they helped us to co-create the products, but also because relationships were so key to this kind of exercise, to build trust and to build understanding of the concepts of gender responsiveness and social assistance, which weren't really getting much play in Eswatini. Circumstantially, there were lots of real practical entry points and therefore clear recommendations that we could make stemming from the analysis and these engagements, including the development of a new social assistance policy, which is still in the pipeline, and a new national social registry, which we were able to really kind of latch onto and offer some recommendations on how that could be developed over the next year or two as well. What was harder was cementing or even getting our foot in the door for some of the key relationships which we might have expected to have. And honestly, as a foreigner, it took me, you know, a few weeks to figure out why that was. And it wasn't that we hadn't made enough phone calls or sent enough emails or bugged enough people. Actually, it was to do potentially with the wider political economy at play in Eswatini. So there was less traction with certain senior decision makers that we would have liked to have had around the table, and that we might have seen different results for had it not been around political causes that aren't necessarily flavour of the month in Eswatini. And what I mean by that is women's rights. Another barrier, I guess, that I haven't put up here as well was around the lack of accountability in many government mechanisms, which again, there was a bit of a difference between programmes that had international development partners involved and which were government-run programmes. On the one hand, it's fantastic that Eswatini has had 100% domestically funded social protection programmes for a long time, for 20 years with the Older Persons Grant. The corollary of that, when run by a government that doesn't have the strongest of accountability mechanisms, is that the systems themselves are quite opaque, and there's really a dearth of monitoring and evaluation information or accountability to citizens as well. And finally, the big point that I guess I'm trying to make throughout the whole of this presentation is that while we might have, throughout the course of our analysis and our roadmap, built a strong technical case for certain interventions, adaptations, innovations, that didn't necessarily equal a political case for these changes. And because it's not a typical context, it was actually quite difficult to work out what the political levers were to pull. It's a very unconventional kind of setting. So that all came into play. Next slide, please. So very quickly, just to touch on some of the key assignment conclusions and recommendations. We did find that the system was largely gender blind, and quite hard to determine what the intention was with a lot of programmes, because there was a lack of documentation, though policies help to kind of retrospectively often make up the gap by saying, you know, this is what the programme or this is what this intervention is trying to do. So we could kind of use that as a proxy for programme design documents. There were some promising gender sensitive practices, but also some concerning gender discriminatory issues, both of which really came off as unintentional and again as an artifact of either people being themselves conscientious and caring and sensitive towards different needs across the different genders, and some gender discriminatory issues for the reverse, often just kind of unwitting reliance on people who often have the least to give within communities, and in particular with the school-based programmes, a really heavy reliance on volunteer volunteer kitchen assistants and caregivers. So the programme recommended lots of practical steps to enhance gender responsiveness and strengthen the system overall. Oh, my time is up. I'm just going to wrap up now. Next slide, please. Just a little bit more context by way of finishing. I'll do this on the last slide very quickly. It's important to understand all of this in the context of a country that is officially rated by Freedom House as not free at all. That the dual political system really had a huge influence over everything, and that size mattered, in that often we were leaning on what was a very small government staff to get things done. And actually, when it came down to it, the Department of Gender had, 2, maybe 3 people in it, because it wasn't the most politically popular department. And most departments in a very small African country will be extremely small. So that all needed to be taken into account. I'll just finish just 2 minutes for the next slide, if that's okay, and then I'll wrap. So what we learned from this was that the light touch political analysis very early in the process, like even earlier than we did it, and perhaps even built into the terms of reference, would have been incredibly useful to frame the design as well as the analysis. So for example, when building a strategic approach and relationships built on this, I think we would have had more of a focus on the traditional leaderships, building on that understanding of how central they were actually to how social assistance programs were operating on the ground. Also, as the international researcher in the team, would have understood the circumstances of local researchers and interviewees a little better, in that it's quite difficult to communicate openly sometimes, particularly over the phone. Understanding the position of the ruling elite was really key, and looking for that common ground between the technical and the political in order to form the roadmap recommendations. And that enabled us to frame those recommendations in the art of the possible. And I think finishing off this presentation where the last discussion ended, making sure that everything was as realistic as possible, was critical to delivering what I hope was a useful piece of work to government and to UNICEF. Thank you very much.
Thank you, Sam. And sorry to rush you at the end, but really important hearing some of those challenges in that kind of political environment. And colleagues, if you have any questions, please do start putting them in the chat, and we can come back to some of the more detail on some of the issues that have been raised. So I'm now pleased to hand over to Muriel from UN Women, who's going to talk a bit more about the technical assistance received in Côte d'Ivoire with a perhaps slightly more conducive policy environment. Over to you, Muriel. Thank you.
Thank you, Rebecca. Yes, like you said, I will talk about some of the lessons learned from the technical assistance that we received in Côte d'Ivoire. Next slide, please. In Côte d'Ivoire, as a background, the story started in 2023 when the Ministry of Social Protection was developing its new national social protection strategy. So they requested the support from UN Women to conduct a gender review of the document. And even though the document mainstream gender in its design and the services and different components, the review identified the fact that it didn't include the issue of unpaid care work. In Côte d'Ivoire, women spend 4 times more time every day on unpaid care work, which is taking care of their sick family members, their children, going to go fetch water and wood. And then that time poverty has an impact on their participation in the labor market. In the country, you have more than 67% of women aged between 25 and 54 years old that are unable to access the labor market due to the time poverty on unpaid care. And even though they are able to enter the labor market, usually you will see them in the informal sector or doing part-time jobs. And the social protection system in Côte d'Ivoire is a contributory model. So as it is, individuals have to work in order to contribute for later years. So this really penalizes women who are often less or not present in the formal sector. Next slide, please. After the gender review, the Ministry of Social Protection and the Ministry of Gender in December 2023 hosted a multi-stakeholder workshop with all the different stakeholders with the idea of developing a care and social protection roadmap. The idea is to have a roadmap that could accompany the national social protection strategy that will include provision for care infrastructure, care services for women in the region. And that was the beginning of the collaboration with STAR. So we requested expert for STAR, and then at the same time, UN Women launched its Feminist Economist Task Force, which is a network of economists that we deploy in country offices to support policymakers towards leveraging more investment, more reforms in critical catalytic area for gender equality, such as the care economy, the green economy, trade and entrepreneurship, and innovative financing. Next slide. Yeah, so just briefly to present the assignment model that we use. So STAR provided two consultants, one international expert and one national expert on gender responsive social protection. And then UN Women provided country economists with expertise on care economy and macroeconomic policy. So they provided mainly three types of support in Côte d'Ivoire. The first one was evidence-based research, doing analysis to really make the linkages between the care economy, social protection, sustainable development, economic growth, so that policymakers can really understand that. The second element was reform. That was through capacity building to the different stakeholders, technical assistance to different line ministries, parliamentarian mayors, in order to prioritize investment in the care and social protection sectors, and then also supporting national and local policy dialogue for the design to collect information towards the design of the roadmap. The third element was also to contribute to our regional advocacy on care. And the team received support from the regional office through the task force, support mainly to identify linkages between care and other areas of work, or to start thinking about new ways to increase fiscal space, to increase revenues for government to continue to finance the care and gender responsive social protection reforms. Next slide, please. So the next slide is just some key result in Côte d'Ivoire through that one-year assignment. We've seen a significant transformation on prioritizing the idea that the context of care and social protection in policymaking. So in December 2024, there was the second national policy dialogue with the validation of the care roadmap. So the roadmap includes provision to recognize, reduce, and redistribute women's unpaid care work, but also element for the paid care sector as well. And then a national care committee was established, in order to continue the work and then operationalize the roadmap. In January earlier this year, a decree was adopted in Côte d'Ivoire to extend the parental leave provision for public servants. From mothers, it went from 3 to 6 months, and then for fathers to 3 days to 30 days. Discussions are ongoing to see this to be extended also to the private sector. In May, there was a high-level policy dialogue with parliamentarians to see what are the key reforms, legislative reforms that are needed to advance the care economy in the country. And then in June, there was a signed declaration of the Association of Mayors reaffirming the commitment to prioritize care in their local development plan, local development investment plan starting from next year. And currently, the country is in a process of finalizing this new national development plan. And through this technical assistance, gender and care consideration are embedded in that plan through the support to the Ministry of Gender. Next slide, please. Not only in Côte d'Ivoire, but also in the region, we've seen the spillover effect of this assignment to continue to increase the presence of care on the policy agenda. And then also for UN Women internal work, the experience from Côte d'Ivoire was useful to inform our new care strategy for transforming care system in the region. It also enriched the work of the task force, open new avenues of research and then work. For example, on the issue of the nexus on care and green economies, the reflection now is to see how we can have social protection mechanisms that can at the same time mitigate climate shock for grassroots women, but also mitigate unpaid care work for these women. There was also the issue of domestic and innovative financing. Countries in the West and Central Africa, such as Côte d'Ivoire, often have limited fiscal space. So what are the ways to increase that, to continue investment in social protection and care infrastructure and services? But the best practice of Côte d'Ivoire has been presented to the ECOWAS Commission earlier this year during the UN Women ECOWAS regional workshop on care, where we are trying to have a regional roadmap on care that member states can really follow at the country level. The best practices has also been disseminated across regional convening that we had in 2024 and 2025. Next slide, please. I think that is the last slide. Perhaps to talk about the challenge faced and lesson learned. For this assignment, we didn't have any institutional challenge because since it was a request from the government. But it was important for us to align our technical assistance timeline to the government pace. We had a 1-year technical assistance, and then sometimes it's not really aligned with the way the government works. So we needed to have flexibility around that. The second one is that even though we've seen some reforms already in Côte d'Ivoire, the process is really long. So reforms take time, and then that require continuous support to the country and also to the different stakeholders. The third one is perhaps one of the next steps. From the government after this assignment, there was this idea to have a second step, which will be to really support them now that they have the roadmap, how to finance that roadmap. So how to identify sustainable financing option to continue to have stronger and gender responsive services and infrastructure in the care and the social protection nexus in the country. So I think that's it. I'll stop here. And then if there is any question, you can drop it in the Q&A. Over to you, Rebecca.
Thank you, Muriel. That was really, really insightful presentation on the experience of Côte d'Ivoire. I'll continue moving on, and as Muriel said, also please do put some questions in the chat if you'd like any further details or have any burning questions. And let me now hand over to Aline from the World Bank to reflect on your experiences. Thank you.
Many thanks, Rebecca, and I'm very inspired by what I heard from my colleagues. It's wonderful to see the different mechanisms technical assistance can work. Thanks for having me today. What I'm going to be talking about today, if you don't mind putting the next slide up, please, Paulo. Thank you. So there's only one. It's just to guide you through what I'm going to share with you. I'm going to talk to you very briefly about the context of the technical assistance in the Sahel. Then I'll go through quickly the achievements of this current TA. And then to be able to, I'll share with you some of the challenges that we found and some of the opportunities we found, or the lessons, and then a few lessons for the future. Just for way of context, I work with a program, manage this program called SASPP, Sahel Adaptive Social Protection Program, which basically supports 6 countries in the Sahel. And it supports the national governments in implementing their national social protection system. This is a live program. It's a program that supports and kind of informs around over $1 billion of investments in IDA over the last 8 or 9 years. So the technical assistance was really requested to improve the gender dimension of an ongoing program. As you can all imagine or know, the situation for women and girls in the Sahel is dire. There are very entrenched structural inequalities and very significant gender gaps across a lot of dimensions, whether they're economic, social, or in the dimension of empowerment. And of course, in the region, as many of you know, all these gaps and inequalities are exacerbated by conflict and fragility, especially in the last 5-6 years. The programs that we've been supporting for the last 10 years, most of them actually target women. They actually have women as their main beneficiaries. However, we realize and we acknowledge the fact that we can do more beyond selecting women as beneficiaries. We can do even more to improve gender outcomes. And so what the technical assistance was requested for was to help us improve the design of the systems, the design of the programs, maybe improve their delivery, and improve the way they are monitored and evaluated so that they can have an even greater impact on gender beyond the fact that they target women. We were provided 7 months of technical assistance under the STAR kind of program. The assistant was provided by Juliette Siebold, who is in the room, I believe, who is fantastic if any of you want support. Now, in terms of achievement, what was interesting in the achievements of these technical assistance is that they were very different nature, right? At the very strategic level, Juliette, with her support, really helped us kind of improve and shape a new phase of our program, which is just starting, and kind of strengthen our commitment to gender responsive social protection in our design. And this was reflected, with clearer objectives for gender, a very kind of deliberate intention to develop approaches that work better for women, and a much greater range of indicators to measure impacts on poverty and resilience, and in particular on women, and other gender outcomes. This strategic kind of note, in a way, or a kind of the definition of our new phase, it does hold us to account. This is the concept note we go to donors with, and so this is what we are held accountable for. It was a way for us to commit to it very strongly. The second achievement of the technical assistance was quite different in nature. It was really about providing, it was more technical, it was about providing guidance to improve the design and implementation of our programs. And so what Juliette did was to provide guidance to our stakeholders, but mostly our own teams, on the importance of developing systems that are gender responsive, and to kind of help us identify what is still needed for us to do to maximize the impact of the programs on all, but also to contribute more to the empowerment of women and girls. So that paper reviews good practices and proposes a roadmap for the implementation of the program in the next 5 years. And then the third type of achievements of the initial technical assistance was very operational. Juliette worked hand in hand with a few of our teams who were working on foundational documents that we use every day, technical guidance, very operational. And she helped bring a lens on gender in some of these areas of work that maybe would have neglected it without her inputs. To give a couple of examples, she kind of she was instrumental in bringing a gender lens in a document that's guiding us on how to implement social registries and how to make them more dynamic. She helped us think through how to make them more gender sensitive and gender responsive. And she also, as another example, provided direct operational guidance to our internal guidance on how to work in fragile and conflict environments, helping us make sure that the adaptations we make in those contexts, in those fragile contexts, not only respond to fragility, but also are gender responsive. So in terms of achievements, that technical assistance was quite varied. Which is what we needed in a way. So we're grateful for the flexibility. Now, turning to the challenges, reflecting on it with Juliette, we thought there were three main challenges. The first challenge or the first kind of lesson was the importance early on in the technical assistance to align perspectives and to find a common ground. Oftentimes, a technical assistance expert will come in with his or her background and his views on how things should look like. And the team that receives the assistance might have a very different set of expectations or desires. And there might be things that we don't want to cover, things that we want to cover. And so it was really important to align our views on the scope of the technical assistance and to go over different issues, decide which ones we decided to tackle and which one not. And this was very much a two-way learning. It was important for us to be clearer into our expectations, but it was also a good moment for Juliette to help us maybe open our minds to other areas that we might have not thought about or might not have been open to initially. As part of this kind of initial investment in aligning perspectives, it was also very important to see how we could maneuver these issues in a way that would gain traction with our teams. We have a very large team of people in the field and implementing and supporting the government day in and day out. They work on very different aspects of design, policy, delivery. They work in very different contexts throughout the Sahel. And it was really important to find a way that would gain traction with all these different actors. And so in a way that, one of the lessons there around this first challenge was that it takes time to find the right mode, and it takes time to receive technical assistance. Oftentimes, the team that received the technical assistance might not be able to make enough space for it. And it is important to take the time to receive it, to take the time to shape it, and to really take the time to embed it. And I'll come back to that in a minute. That makes a huge difference, to be able to spend weekly meetings with our cameras on so we could see each other, and to really take the time to agree on what we needed. What's the result of that first kind of challenge and lesson is that 5 or 6 weeks into the assignment, Juliette was ready to really hit the ground with the team. She got involved with the wider team, and she was able to really propose something that resonated with my colleagues and our counterparts. The second challenge or lesson is around making sure to be accepted and to become embedded within a team. Technical assistance is not something that is dropped onto a team. The only way to really make it work is to convince people, to work with them and work with them in a way that takes the time to convince them of the importance of making some adjustments. And that requires a kind of an approach that's quite complex. That's both complex technically, but also complex at the level of personal relationship. And so, as you can imagine, in the Sahel, there's an added difficulty, which is that the language of gender in the Sahel can be quite challenging, not only for our counterparts, it's also challenging for our teams, for our own colleagues, and for the people that are implementing the programs. And so, it's not easy necessarily to broach this topic. Some of the terms and some of the concepts don't even translate into the local languages or into French, as many of you know. And so, because that applies to all of us to a certain extent, it was very important for Juliette to approach our team with respect and to meet them where they were, to kind of provide advice in a very diplomatic and very tactical manner. And she, the whole point was to try and be forward-leaning, but to always be extremely mindful of the potential for backlash at every level, whether it's our team, our counterparts, the recipients, the implementers, the policymakers, whoever. So technical assistance, in a way, needs to have empathy. It needs to be able to understand where people start from, and to respect that, and to be able to be respectful of it, which is not always easy. And I think, one of the things that we discussed with Juliette early on is for her, the need for her to remove any advocacy hat she might have been wearing in the past, and not to try and impose, but really rather to test the temperature, assess the wind direction, and then use her technical ability to identify areas that could be promising. So the lesson there was really that you achieve more by working with, not working against, and by convincing, not by talking at people. And for genders in contexts such as the Sahel, that really can sometimes mean not talking about gender, not saying the word gender might be what is needed to be able to be impactful. So that was the second challenge or lesson, or that we faced. And the third one was to really also make the technical inputs relevant, accessible, and acceptable. It touches upon some of the same concepts, but basically, one of the ways Juliette found to be very impactful was to start with what people were already doing well, and to start by finding practical examples of what had been done on gender already, even though it might not have had the label of gender, and to work, very closely with people, with our colleagues, to understand their work and start from there, and make them feel a sense of pride for all the achievements and that they had already made in terms of gender, even though there's still a lot that can be done. Starting from a basis of pride, and makes it much more accessible and acceptable for colleagues. And so in a way, the products that she prepared are very important, but they beyond the actual document or the actual edits or the actual presentation. These products embody an important process of engagement, and the kind of exchange of ideas with the team members has been really important, in that it has provided a space for reflection and for learning. And so one of the kind of it's improved the knowledge and the confidence of our teams that they can do better, they can integrate gender without challenging their own beliefs or their own norms, or without being told that what they do is not appropriate or not acceptable. So these were the challenges. And so let me close by at the request of the team, trying to think about the lessons in terms of what was critical in the way the technical assistance was provided. First, and started a fantastic job in selecting a technical assistance provider that had expertise. And here I'm not talking about technical expertise also. She also had a very strong expertise of the region, which was really important because it meant that she was able to start from the right place. The flexibility of the approach was very important as well. Some of my colleagues have mentioned it, the ability of STAR to let us kind of shape the TA over time and maybe change a bit what we had initially thought it would do, so that it could be very responsive to the needs of our team. Third, the resources. It was quite important, I feel, that the technical assistance provider had a team behind her that could help her kind of, verify some of her instincts, or maybe supplement some of the knowledge that she had. And so we felt as recipients of the technical assistance, that there was a team behind Juliette that we could also draw from. And last, and I will close with this, the attitude was very important. Change is profoundly political, it's profoundly emotional, it's not a technical thing. Changing requires a respectful approach, so that the team is willing and interested and keen to implement the changes. In closing, just to say that although the technical assistance has changed, our teams have expressed their need and their requests for much more support from Juliette and other consultants. So I'm happy to report that she's already working on another 6 assignments under the different countries or the different topics that we cover. And so this is also one of the TA's achievements, is that the demand has been kind of created. And so that's in a way a testimony of the quality of the technical assistance. I'll start here and happy to share any more insights as you need. Thank you.
Aline, thank you very much. Really, really great to hear all of that, and just emphasizing sort of the importance of the person in delivering the TA as well, and the way that relationships need to be built and sort of invested in as well for the technical assistance, not just to deliver technically, but that kind of politically as well. So thank you for highlighting all of those really important points. Great, colleagues, we have about 15 minutes for some Q&A. I've seen that there are a couple of questions in the chat, so let me just have a look at these. We've got one question which I would like to ask Sam and Bopha to respond to. So the question is, what are your key recommendations for ensuring that technical assistance builds real ownership of the agenda within the recipient organisation that will last beyond the technical assistance period? So Sam and Bopha, do you have any insights or reflections on that question? Bopha, let me go over to you first. You're on mute. Oh, yeah.
Thank you, Rebecca. I think that to build the ownership of these recipient of the technical assistance, first to buy them in about the importance of gender responsive in the social protection system, because of the ultimate goal of gender of social protection is to eliminate the poverty and also the vulnerability, to reduce the poverty and the vulnerability. So without considering the gender responsive in the social protection system, their ultimate goal will not be met. So this is need to discuss with them, need to talk with them. Of course, that they understand with that, but they need to have the practical experience from other countries as well, to show about the benefit of considering the gender responsive in the social protection system. I think that it is very significant to start from this, and also to build the capacity, because sometimes they understand how it is important, but they need the capacity and also the tool in place in order for them to to imply it in their real work or in their practical work. So capacity development and tool in place is very significant as well. Yeah.
Thank you, Bopha. Sam, would you like to come in with any additional reflections?
Sure, thank you. And it's a great question. I mean, I suppose I've still got Aline's words ringing in my ears around that it takes time to receive technical assistance as well. And I think that is actually one of the key takeaways I'm going to really carry with me from this discussion, in that it's not a quick, you can drop in some wisdom and go away. It's actually, it's a process, and it does take time, and really building relationships with people and making sure that they understand and are on board with recommendations, or if they're not, really getting behind what it is that's going on, which is linking back to the subject of my presentation before, which is really about also understanding what is possible for policy officials, for UNICEF, for other actors to take on board, and what's actually genuinely out of bounds, and either working around that or working with it. The final thing I'd say just on that is finding policy or program hooks that are practical and have legs for the longer term. So to take a couple of examples, or one example in particular from Eswatini, we knew that the social registry was being developed, so we could kind of hone in on that and go, well, we don't need to rely on there being a political judgment around this. This is going ahead. So what does this really mean for the social assistance system going forward? And how can we link practical recommendations into that, not just for the immediate term, but for the next, 3 to 5 years? So just some thoughts on that.
Thank you. I see we have got another couple of questions, so let me start getting through them. We have a question about, if we talk of a gender-sensitive social protection programme, what key features are we looking for? I think the presentations that we've had have been really insightful in terms of picking up different aspects of what gender-sensitive or gender-responsive might look like. But just in terms of answering that question, maybe I can come to you, Sovannary, to ask you in terms of, the social protection in Cambodia, what you feel are the key elements of the Cambodia social protection system, and what are the key gender-sensitive, gender-responsive elements?
Thank you. That's a good question, Rebecca. So I think this is talking about the gender continuum, which is the gender-sensitive, gender-responsive as such, and like I mentioned in the discussion with Mrs. Bopha, actually the picture was not clear about what is the gender-sensitive, what is the gender-responsive, whether if there is any key checklist that us as a policymaker to have a look at that, to design how to make the program more gender responsive, more gender sensitive. By answering to the questions, how do I see gender sensitive in this case is actually by what I received from the gender assessment in the social protections, which most of the analysis says that many program has been made gender responsive already. On the other hand, some programs that aware of the gender aspect, but there's no specific address to the need of the gender, one that really make it the program and the scheme rather gender sensitive. So if I might not be able to answer the question like right on that part, because currently we are trying to develop, trying to find what is the if there is any checklist on that as well. But this would be my answer to the question. Thank you.
Thank you, Sovannary. And I see that Aline's put a few things in the chat as well on that. Aline, there was another question, I think, to you. I think it was in the chat rather than the box, but let me just come to you on this. There was a question about what's been the role of the ministry responsible for gender in making social protection programs more gender responsive.
Thank you, Rebecca. And I was trying, of course, the experience changes across the different countries, but overall, it hasn't been very strong, that connection. So the involvement of the ministry responsible for gender equality has been rather limited. In a few cases, they were involved in kind of reviewing some of the materials. They're asked to help us shape some of the design of the programs or some of the content that's used in addressing the needs of the beneficiaries, but mostly it has been limited. And I think this is also maybe a limitations of what we have done, right? And so far we focused on making sure that the programs and the systems we support are better designed and better implemented. But there's another layer of advocacy at a higher level, at a policy level, which I think some of my colleagues mentioned in especially for instance in Côte d'Ivoire, where there's also a role for technical assistance to inform and to guide the gender machinery institutions that can shape policy so that they change the context within which social protection then works. But this is an area that we haven't fully explored yet, other than on an ad hoc basis. But it's a very important one.
Thank you, Aline. And maybe I could just sort of extend that question to Muriel, if you could maybe come in on those reflections from the Côte d'Ivoire experience, or more broadly in the region that you're working on sort of the importance of that sort of layering of different types of technical assistance and the sequencing of that in terms of affecting policy change.
Yes, I think for the case of Côte d'Ivoire, well, between 2023 and the end of assignment in 2025, but a lot happened, mostly within the different ministries, changing the people. But also, I remember the first national stakeholder policy dialogue in December 2023. The actors that were there, they were completely different in the second policy dialogue in 2024. So it's like starting the conversation again, but even if it's the same key institutions, but the people, the technical people have changed. So I think that was one of the key things, to continue the discussion, to continue the policy dialogue. And I remember in the 2024 policy dialogue, there was one of the actors, and he said, the title of the event was Care and Gender Responsive Social Protection. And he said he was a doctor. So they sent him because when they heard care, when you translate into French, it meant actually healthcare. So they sent a doctor from and then first he was shocked, but then through the conversation, he really saw the linkages between care economy and the broader sense and the healthcare. So like Aline said, it was really important in French countries to really contextualize the topic of care economy, translate it into French. That has been really difficult. And then now trying to make it the linkages between sustainable development. Different ministries work on a different area of care. You have the healthcare, care infrastructure, social protection, education, but then there's often not a coherent approach, or people don't say it. So the work to the technical assistance is to have that coherent approach, have all these different stakeholders talk together, and then try to have a holistic view while designing the roadmap. And there was one question on the Q&A, how do we ensure that after the technical assistance, the work continues? I think having such roadmap or strategies that becomes a commitment for the government really is a good thing, because they have to follow it. There are indicators, there are women associations, there are civil societies that will follow up on the work to make sure that they really implement all the activities and in the country in the future, even beyond their assignment. Thank you.
Thank you. That's really good point. I see that we've got a couple more questions, but I'm not sure we're going to have time to answer them, unfortunately. But Sam, I can see that you're typing a response to one of the questions from Jenny. Maybe you could just very quickly, in sort of 1 or 2 minutes, just come in and maybe highlight some of the key issues that you were going to raise. So Jenny's asking about sort of the challenges and complexities of building trust and the need to adjust sort of terminology and the way we talk about things for different audiences. If you've got a minute or two, you could just talk about that. Thank you.
Thank you. Yes, I did begin typing and then realised it would be an essay, so I'll try to be quick. Yeah, so it's another great question. This is, again, going back to the importance of relationships and understanding. what the real political economy is in sensitive contexts, and the things that people can't necessarily comfortably publish or talk about openly, but is invaluable in understanding what's actually going to be impactful. So, for instance, if certain power elites are extremely hostile to women's rights, for instance, how does one deal with that? And in the real world, and I think many of us have dealt with this in different situations, women's rights can be pragmatically pitched in different ways if power brokers are not willing to listen to that kind of language, and instead it can be, okay, so women's rights are good for everyone, gender equality is good for everyone, and pushing those sorts of arguments, or arguing for caregivers or for children as a proxy to what is often also shared rights with children. The other part of that question was around terminology, and I just had one kind of slightly adjacent example, which was less about the actual language contained within documents and more about how to engage in workshops and really kind of get people engaged in a subject that they weren't necessarily particularly on board with in a workshop, which was actually to, again, work with local colleagues to use ways of communicating that were more in line with, say, traditional practices, and actually actively saying, if I was the king, I would say this. Or if I was running a certain type of community meeting, I would say that. And suddenly people would light up in a way that I would never have been able to even begin to understand as a foreigner. So I realize that's not specific to the question, but it was a real light bulb moment for me in terms of how to run a workshop in a context that I didn't fully understand.
Thank you. Thanks, Sam. And I think that just highlights something which STAR has really worked on, and sort of the principle of working with national and local consultants. I think it's just absolutely key for this kind of work as well. Okay, let me hand over to Heather from FCGO for the final few words before I just come back and do a final admin close. Over to you, Heather. Thank you, colleagues.
Thanks very much, Bex. Can you hear me okay? Brilliant. So thank you to all the speakers, all the participants for this fantastic session today, and for the opportunity to give these closing remarks. I've had the pleasure of being involved in the STAR facility and its predecessor space since the very beginning, during which time we've seen demand for technical assistance on gender and social protection just continue to grow and grow. It's been especially rewarding today to hear from panelists about how STAR has delivered TA across such a diverse range of contexts and thematic areas. And it's also been really valuable to hear the perspectives of both those providing as well as those receiving the technical assistance. The evidence is really clear. Social protection can deliver transformative outcomes for women and girls, and it's essential for advancing gender equality. But these outcomes, as we all know, they're not automatic. We have to be intentional, starting from program design right through implementation, about recognizing and addressing the distinct needs and barriers faced by women, men, girls, and boys, and the gendered power dynamics and social norms that shape their experiences. Yet, as we've also heard today, this intentionality is just not routine yet. Review in 2022 of national social protection strategies in sub-Saharan Africa found that while many strategies acknowledge gender risks, very few actually included concrete actions to address them. During the COVID pandemic, despite the massive social protection rollout, fewer than 1 in 5 social protection measures globally addressed gender. And when gender is considered, it's often seen as synonymous with targeting women as a vulnerable group or in their role as mothers or caregivers. But we know that's nowhere near enough. Aline highlighted this also. To close persistent gender gaps, we must go further and embed gender responsiveness at every stage. Throughout today's discussion, one thing has been really clear to me: high quality technical assistance is absolutely critical. It helps to build strong partnerships, it ensures interventions are evidence-based, and it provides practical tools to make systems work, not just on paper, but in people's lives. And we've also heard today that this work is often not easy, but we are constantly learning more and more about what works. So I'd like to highlight 4 principles for us to bear in mind in delivering effective TA on this agenda. The first is build capacity, not dependency. So TA should empower local institutions, not replace them. This means providing it in a way that truly builds capacity, investing the time to understand political and organizational realities, as several of you have highlighted, and co-creating solutions that are locally owned and sustainable. The second is align with broader agendas. We know that gender responsive social protection often gains traction when it's framed within priorities that organizations already care about, such as productive inclusion, GBV prevention, care. Technical experts can play such a vital role in identifying what these entry points are, seizing the policy windows, and grounding their engagement in robust context-specific evidence. The third principle is prioritize local expertise, which has also come up today. National advisors, local champions, regional peers, they all bring essential context and access. Their engagement ensures that advice is relevant, trusted, and more likely to lead to lasting change. And fourthly, let's focus on meaningful impact. So successful TA isn't just about activities delivered. We must be more ambitious in how we measure its impact, going beyond attendance numbers or reports written to think carefully about the diagnostics and resources required to track real change. Those were my sort of 4, but of course we've heard so many more during the conversation today, including having a clear ask of the TA, but also having the flexibility to adapt. I think every speaker mentioned flexibility. Having TA at the right time, but also recognizing it can take time both to provide the TA, receive the TA, bring about change. Being context specific, being politically smart and good at building relationships and not just technically smart, and having that dedicated expertise to bring the gender lens, and so much more. There are so many more we could pull together. If we want gender responsive social protection to become the default, not the exception, then effective TA, drawing on these principles and others that you will all have identified from your experience, must remain embedded in our efforts to expand social protection coverage and strengthen systems. So with that, thank you very much again to all the speakers, the participants and the organisers for your very engaging session today. Let's keep pushing forward on this together. Thank you.
Thank you so much, Heather. Really inspiring and wise words to complete this webinar. Also, just to echo our thanks to all of our colleagues who spoke today, to the colleagues at socialprotection.org and staff for supporting the webinar, and of course for all of your attendance and your discussion and your questions as well. As I mentioned previously at the beginning, we do have 2 more webinars in the STAR series on women's economic empowerment and LGBT. So please do look out for these in October and November. Do check out our resources on socialprotection.org and STAR. And we also do request if you could please fill out the survey, which the team I think will be or has put in the chat as well. So a very big thank you to everybody involved in this webinar as well, and look forward to continuing the discussion on gender responsive and inclusive social protection. Thank you, everyone. Bye for now.